Assalamu alaikum. Welcome to Agamir Pothe. Tonight's discussion is about COVID-19 and our mental health. We'll be discussing the impact of the pandemic on our mental health, how it has affected our lives at home and our lives outside of it. To discuss this and more, I have got two guests. দর্শক আজকে আগামীর পথে অনুষ্ঠানে আপনাদের সকলকে স্বাগত জানাচ্ছি। আমি হাসি খান। আমরা আজকে আলোচনা করতে যাচ্ছি কোভিড-19 এবং আমাদের মানসিক স্বাস্থ্য নিয়ে। আমার সাথে যোগ দিয়েছেন দুইজন অতিথি যারা আজকে আলোচনায় অংশগ্রহণ করবেন। আমি প্রথমে পরিচয় করিয়ে দিচ্ছি খুরশিদুল হক, সিনিয়র সোশ্যাল ওয়ার্কার ইন দি চাইল্ড কেয়ার সেফগার্ডিং। ওয়েলকাম টু মাই শো। He's all from Birmingham. And secondly, Dinar Hossain, public servant and community activist. Welcome to my show.
Assalamu alaikum. দর্শক মণ্ডলীকে সালাম এবং শুভেচ্ছা জানাচ্ছি।
আসসালামু আলাইকুম সবাইকে। আশা করি আপনারা সকলে আমাদের অনুষ্ঠান উপভোগ করবেন এবং আপনারা feel free to like and share and comment. আমার প্রথম প্রশ্ন আপনাদের দুজনের কাছে একই প্রশ্ন বা প্রথমে খুরশিদুল হক, how have you been impacted by the pandemic? So you both are working and you both have a families. So how have you been impacted?
I think it's important that we discuss the way we are affected. It is undoubtedly a time of difficulties for all of us, and needless to say that it impacts on the mental health of every individual, whether we're adults, professionals, elderly, children, women, in any profession that we're in, because of the way we are all as individuals. Without a doubt, it has impact on us, and how we cope with it is an important issue, and I'm sure we will be able to discuss this in more details in the topic tonight.
Thank you so much. Same question to Dinar Hossain. How have you been impacted? Like I said, you are working and you have a family too, and we all are somehow impacted.
Thank you very much. It's a very good question. On a personal level, I must say I've not been impacted that much because I'm responsible for managing key workers provision, which means I have been required to go to work on a day-to-day basis. And on a very minimal level, I've been working from home. So I have been traveling, I've been going out and about. I have the opportunity as a social being, which is the fundamental requirement, is to interact with others as well as colleagues. Privileged opportunity I had in order to interact and communicate with my colleagues in all level, or the face-to-face or virtual. However, it is absolutely important to note that COVID-19 will have profound effect in all aspects of our society that we are living in general. However, there is also a segregation between rich and poor, people from vulnerable and disadvantaged backgrounds.
We'll talk about it a bit more later, as we go along. But in terms of, I know you told me that you were working from home, and because you are living kind of a normal life, you are not that much impacted. How about your family, children, etc.?
My family, yes, to that extent, if you like any other children, they've been out of school. They have not been able to interact or communicate with their classmates like the way they do on a face-to-face basis on a regular basis. Unfortunately, during the lockdown, every children were required to stay indoors, turn the computer on, taking lesson from on a virtual basis, and so on. And that absolutely distracted in terms of their social life. And as a children, as a young person, we all been through that age. We know that it is one of the fundamental requirements that we learn through interactive process, through
Absolutely. We'll go
face-to-face
into that
interaction, and
again.
so on.
Yeah.
Sure.
So, but as a family, you are coping okay, I suppose.
Alhamdulillah, yes, it's been okay so far.
Right.
Yes.
And
Thank you.
same with you, Khurshid al-Haq. I mean, in terms of family, in terms of obviously you are working and you are in out and about or working from home, but in terms of family, you are coping okay,
I think
personal level.
it's important, as stated. We're as individual, we're all affected differently. Uh, Different things affects us differently. Professionals are affected in different ways. Um, I've been impacted by the pandemic in the sense that as a social worker, I've been for the last 6 7 months been working from home, literally not been able to sort of have much interactions with any of my colleagues. Most of our meetings has been virtual. Uh, Most of my interactions with my service users, young people that I work with, has also been virtual. The meetings I have has also been virtual. The community associations that I have, and the kind of meetings that I need to have on a regular basis, they've also been sort of virtual. Um, it is the new norm, as we would all accept, and so therefore, any new changes takes place, it has impacts on every single one of us in terms of the way we cope and manage, and to live with it. So on a professional basis, it's impacted on me. On a personal basis, it's impacted on me because my father, who's in his 80s, I've not been able to go into his house and see him. The two Eids that we've just sort of recently passed, we've not been able to have the rituals or the regular ways that we
Gathering.
enjoy, the gathering. Not only that, in terms of the weekly congregations that we have, within the masjid, that
Sorry,
we've
excuse
not been able to sort of enjoy. Um, all of these things have really sort of significantly impacted on every one of us in various different ways. Some have coped well, others have not been able to cope well. And then that then sort of brings us onto the kind of mental health issues on individuals, and how that impacted on individuals and group of people. And as we would go further into the program, we would be able to sort of discuss how that impacts on individual.
others. Yeah.
My dad has not been able to go to the mosque for the last 6 7 months. For an elderly person, that is a huge,
Impact
sort of,
on him.
you
It's
know,
important to him.
because they thrive on going to the
Mm,
masjid. They thrive on meeting individuals at that level. And when your spiritual level at that age, in that way, is impacted, you have to question, well, what is there in life for you, so it's important that we talk about those. But more importantly, and I'm sure we will sort of come onto the topic of how this impacts on our youngsters, our children
absolutely.
as well.
That
So
is the next question to you, actually. Um, yeah, I was going to ask you, how are our children been impacted in terms of COVID-19 on due to the changes in education? We briefly touched it, but in details, if we could discuss. Khurshid al-Haq.
okay, right. So I mean, as
And
a
also,
social
sorry,
worker.
feel free to in between, feel free to speak Bengali if you wish to, if you for
Yeah,
our
okay.
Bengali audience.
That would be fine. Yeah.
Yeah,
So I mean,
both
if
of
I
you.
can start in terms of children, how the children are affected. I mean, children
And
are
when I say
affected.
children, I mean school, college, university,
Yeah,
those who are studying
young people.
online, etc.
Yeah, yeah. They're. I think I'm sure both sort of will agree that the children are affected in many different ways. They're experiencing worries, anxieties, fears, and this can include, sort of fears, so that are very similar to those experienced by adults, such as fear of dying, such as, sort of relatives dying, and sort of the medical sort of aspect, how their medical health is going to impact the children who have not been able to sit exams. We've had a lot of different publicity about that in terms of how they have been sort of impacted in terms of getting the GCSE results on the basis of sort of teachers' assessment. It's not real. We're all psychologically uh, conditioned to think that what is normal for us, what needs to be normal for us, and what is not so normal. So having exam results based on teachers' assessment is not a normal, although it will be something that will be accepted, but it's not normal. It's not the same as going to the exams, sitting in the exams hall and going through so the stress of completing an exam. And so therefore all of these things are hugely impacted. Some are happy because they've been able to get the grades that they wanted on the basis of teachers assessment. Others are not so happy. So it's a balance really, to think, well, you know is this normal? Is this something that we are going to face, forever? There is no certainty when this is going to come to an end, because, as we're progressing more into the winter months, right, we're seeing a second wave of COVID, and the number of sort of figures that we're actually seeing, it's quite concerning. And with the local lockdowns as well, the question are being asked: when is this going to end? In the next year, next May, are we going to be able to complete our examination? Is that going to be a possibility? The government has already sort of delayed the exams by 2 weeks. So, but there is no certainty about
Absolutely.
what's going to happen. What does the future holds for us?
Mm.
All of these things has impacts on children
On their
and young
mental health.
people. Yeah, I
Mm.
mean the recent issues about the Manchester sort of universities, where number of hundreds of students have been into quarantines. Just imagine how they feel. The fact that they've not been able to have their basic shopping sort of
Stuck on
completed.
their hostel, not even in their own
Exactly.
home.
Yeah, and a lot of parents had to step in. So if we take into consideration of all of these factors, I think we need to sort of start analyzing how this impacts on the parents of those children who
Mm.
are having to sort of do all this. Some of the parents are not able to travel as far as Manchester to do their shopping for their children, so they're sitting at home, being worried about their children, and what they're going to do, and how they're going to eat, and how they're going to survive. So it's a kind of snowball effect.
Absolutely. So they are greatly impacted. Okay.
Yes.
Just to support what you said, there has been a study done by University College London, UCL, and it's called COVID Social Study. And they have examined on 90,000 people, and they monitor those 90,000 people, those who are mentally affected throughout the lockdown, and findings level of anxiety and depression fell in. Study found that the finding level of anxiety and depression actually fell during the June as the lockdown started easing, but this remained highest among the young people, those with lower household income.
I was gonna,
You are going to
I
add
was gonna
something,
come
Dinar?
to this. Yeah, I was going to come to this when we are talking about young people. I think it is absolutely necessary to segregate between different cohorts within our society. I work with young people and families, those live below poverty level, who are sharing 7 individuals, mom and dad sharing
We have
two-bedroom
a
apartments with 7
specific
children.
question on that. We have a specific question on the overcrowding housing issue, so we will
But
come
the
to that in a moment.
research the research that you are referring to, when you are talking about mental health, it is a collection of high quality of data
Absolutely.
that combines psychological, social, and neuroscientific aspects. And the data, the UCL that you just referred to, is also talking about not only young people, those
They
are
also talk
attending
about
on a
inequality as
regular
well.
basis.
Yeah.
I'm talking about young people. Those are coming from disadvantaged, very poor
Absolutely.
background, where
And
there
this
is
is
no
what exactly the
certainty
study
for
say.
jobs for their. Yeah, so I'm talking about young people, a cohort that actually don't have any opportunity to sit indoors due to the lack of, if you like, the population within the family members. And I'm also touching on young people who doesn't have a privileged opportunity to sit indoors front of the computer and taking part in a virtual lesson because they have no Wi-Fi at home. And also parents cannot afford to have laptop for them. And I'm talking about young people, they are going to go through, unfortunately, a significant trauma, and that's going to be carrying on for quite a while to come. It's very unfortunate, but I think the research is currently being collected by very many
and
establishments as well.
and it will go on as you. Do you want to add anything to this this question, Khurshid?
I think it's absolutely important that we sort of look at the differentiation. And I think if I can just add on top of that, it's undoubtedly the Black and Asian minority communities, and in terms of the impact, will be different to the wider community. But if I can just use an example of the kind of the people that I deal with, for example, I see families who are single parents who are living in high-rise flats, for example. You're talking about the Wi-Fi. You're talking about personal space. You're talking about Wi-Fi. Those are very prevalent sort of issues to the white communities as well. But of course, within our own communities, the communities that we're from and we have associations with, we need to look at the kind of families that we live in. We live within an extended families where this doesn't allow us personal space. So yes, I mean, you're absolutely right. It doesn't allow the individual to have that space. We don't have the luxuries of having a laptop each for each child to join their virtual lessons, for example.
I'm
So
very
all of them.
we'll explore that on bit more later on.
Sure.
In terms of overcrowding, etc. The next question is to Dinar Hossain. Very similar question, but it's all about adult. So I was going to ask you, Dinar, what impact are our adult health in terms of the COVID-19, the changes that we are facing in terms of employment, furlough, job cut, redundancies, etc.
Absolutely, and thank you for asking me these questions. What we have seen since lockdown, the very many different sectors in the market has been shut down. Government, I must say, has been very kind and coming forward, very supportive. Rishi Sunak announced furlough scheme that's still continuing until the end of October, and also looking at preserving the job. So it's a significant task on any administration and government to balance between health and economy. And I think if you look at, going back to your question in terms of adult, if you look at care homes, for example, we know very, very tragic incident that took place, the number of deaths in care homes. If you look at elderly people, those are under social care. And I'm sure Khurshid Bhai could touch on that as well, because he works for social care. It's a significant death rate. At the same time, if you look at আত্মীয় স্বজন যারা আছে যে ফ্যামিলির, যে ফ্যামিলির অ্যাডাল্ট যাদেরকে বাচ্চাদেরকে বড় করছে, এই অ্যাডাল্ট যখন করোনা ভাইরাস পজিটিভে আক্রান্ত হয়েছে, যখন তাকে হসপিটাল নেওয়া হয়েছে, এরপর থেকে পরিবার পরিজন অথবা সমাজের কেউ তার সাথে দেখা করতে পারেনি। এমনকি যারা মৃত্যুর সাথে পাঞ্জা লড়ছে তারাও যোগাযোগ করতে পারতেছে না, পরিবার পরিজনও যোগাযোগ করতে পারতেছে না। As a result, you can see there is a significant traumatic experience those families are going through. They're severely affected by COVID-19. So, for example, we know number of deaths in this country as well as throughout the world. You look at in this country more than 43,000 plus, and you look at most of the adult, significantly high. And if you look at these people, when they left the world, they couldn't even say goodbye to their loved ones. Their loved ones couldn't even embrace them when they were dying and passing their lives. And that's a significant trauma. And this trauma, and another significant issue about this trauma, that this পরিবার পরিজন অথবা আত্মীয় স্বজন এখনো সুযোগ পায়নি কারোর সাথে কথা বলার, এখনো তারা কারোর সাথে কথা বলতে পারতেছে না। So what you see, they're bottling up all this sad and all this tragic and trauma in their chest. And unfortunately, this is going to be having a significant impact in terms of their emotional well-being. Thank you.
Yeah, how about the people, those who lost jobs and job cut and redundancies? What kind of impact do you think they will have?
Absolutely. I mean, one of the example of Sure. One of the case study if I will give you from my practical experience that I have been dealing with, one of the family, while during the lockdown, they were going through a divorce process for very many different reasons. There is no allegation of domestic violence or anything as such, but father and mother, both of them love their children, and they are growing up very well. For very many reasons, father and mother decided to separate themselves. And during COVID-19, father actually passed away due to coronavirus. And that has impacted significantly among mother being affected by mental health. She's currently been sectioned. And my service is working with some of the young people from this particular family. Their education is severely distracted. Even we got the new academic year started from September, rightly so, because education must be the high priority. They started going to school. He started dropping out from school because the significant impact. He has not been able to express his feelings to his peers because for 6 months they have not seen each other. And such a tragic incident happened. And it's not only one person. There are very many number of young people who is going to schools and they have not been able to talk to their peers, the experience they went through. They are in a silo, and what it means is affecting them very, very severely. They are not able to speak freely to others. That's why services like public services, integrated services, all of them coming together, emergency service, including our police service, council social care, targeted youth service provisions, they all need to come together to have an integrated approach in partnership with schools and so on to make sure that we have a robust support services available for these number of these kind of young people, because they are quite significant.
But do you
They
think
have
people
not
are
been able to
worried?
express.
Do you think people are when we're talking about the adult, people are worried in terms of their job card?
Oh,
Although
absolutely.
some people still are at work, some people, but obviously people are extremely worried what future might hold for them, the potential of redundancy, the job cut, and etc.
I think is quite inevitable. We can see the evidence is already talking about more than 5,000 to 7,000 people are losing jobs on a weekly basis from very many different sectors. Whether you're talking about hospitality has been severely affected during the summer. It was locked down throughout Europe. We didn't have any tourism going on. There is no money coming in. And, we're talking about pubs, we're talking about bars, we're talking about restaurants, we're also talking about cinema, theaters. All these people, they devoted themselves to develop and enhance
people, those who are
this industry.
self-employed people as well. People are
including self-employed.
yeah.
Thank you for mentioning that, including self-employed people. So what we are likely to see now, that most of the sector has been shut down for last 6-7 months, which resulted, and as I said to you before, 5,000 to 7,000 people losing their jobs on a weekly basis across very many different sectors. And this is significantly going to have a major impact in their life, and also about uncertainty about the job in the future. So it's not only people lost their jobs, what is the future lying ahead for them? Is there an opportunity, further opportunity?
People are losing their job, obviously. How are they going to pay their bills, pay their mortgage? How are they going to maintain their family?
So that's
terms of food,
absolutely.
bills.
So it's a very, very absolutely. They have very, very uncertainty lying ahead, and that will certainly, unfortunately, inevitably will contribute in terms of their mental health and so on. And this is why it's very important when we're talking about helping people with mental health or helping people going through such stage, is about responsibility to everyone. Is every citizen will have responsibility to look out for each other, is to help each other, is to interact with each other, is absolutely fundamental, because there are people in silo, they cannot express themselves, they do not know what is. I mean, the person, as an example, who has been working in a hospitality industry for a number of years, for 15, 20 years, and suddenly finding out there is no jobs available in the future, including the airline industry. There are no jobs going to be in the future.
I mean, they're specialized in one skill for many, many years, and in shifting their skill, learning new skill. It's thinking of it is the challenge itself.
Absolutely. Absolutely. In order to acquire skills to fit into a different industry, that itself is a challenge. So you are talking about a traumatic experience, you're talking about job uncertainty, you're talking about job loss, and you're also talking about repairing themselves what they have been through for the future. This is a significant task that it's very complex, and it's a significant severity if you look at the complication the individual going through at this moment. And my heart goes out to them. And that's why I say to everyone, it is all our responsibility to make sure that we support each other, we look out for each other, we maintain it, look after each other. At the same time, above all, very, very important to follow the public health guidelines. Is absolutely important to ensure that we follow those are expert, because public health is not a clinical health. There is no treatment for coronavirus. We got to take it for account. We got to make sure there is no clinical treatment in relation to COVID-19. It's public health. And when we are exactly, and I'm not sure how soon it's likely to be. Very many different researchers saying that we probably have to wait another 12 to 18 months. Unfortunately, as Khalid says, we go winter coming up very soon. So its future is very, it's not very looking very bright in relation to that.
Khurshid, did you wanted to add anything to this question, or shall we move on to next question? Sorry, I can't hear you. Can you unmute your?
Yeah. Sorry
Did you want
about
to
that.
add
Very
anything?
briefly, yeah, just very briefly. Dinar has sort of gave extensive background into the situation, but আমাদের মানে আমরা মানে কুদরতি পক্ষ থেকে যদি আমরা চিন্তা করি, আল্লাহ তাআলা আমাদেরকে সৃষ্টি করেছে যে কিছু স্ট্রেংথ উইকনেসেস দিয়ে, হ্যাঁ, বা কিছু মানে constructive way that we have been constructed as human beings. So inevitably, all of these are bound to have impact on us. Those whose jobs have gone or are losing, businesses are being lost or is about to lose their business. ইনেভিটেবলি যে বিষয়টা আমাদেরকে টেনে নিয়ে আসে, সে বিষয়টা হচ্ছে যে আমাদের মানসিক অবস্থাটা কিরকম প্যান্ডেমিকের কারণে এফেক্টেড হয়েছে। আর সেটার মানে কোনো প্রশ্ন নাই এই কারণে যে অবশ্য আমরা বা আমাদের সবার এই যে প্যান্ডেমিকের কারণে আমাদের মানসিকতা মধ্যে একটা পরিবর্তন নিয়ে এসেছে। আর সেই মানসিক পরিবর্তনটা আমরা কিভাবে কেটে উঠবো সেটাই একটা বিষয়, মানে অত্যন্ত গুরুত্বপূর্ণ একটা বিষয়। সেটাকে আমরা কেমনে কেটে উঠবো সেটা একটা বিষয়।
Absolutely. ধন্যবাদ আপনাকে এত সুন্দর করে বাংলায় আমাদেরকে আমার দর্শকদেরকে বুঝিয়ে বলেছেন। আপনারা টাইম টু টাইম দুজনেই টেক দ্য অপরচুনিটিস, সুযোগ নিয়ে একটু যদি কাইন্ডলি যেখানে সম্ভব হয় বাংলা একটু আমার দর্শকদের জন্য বলেন। Let's move on to next question. Khurshidul Haque, এটা আপনার জন্য question. Do you think the loss of coping mechanism also been a contributing factors in terms of people mental health? Say, for example, you guys did mention, touched it before that, we lost contact with, even you said that you can't even visit your father, he can't go to mosque, people can't socialize. So this question to Khurshidul Haque. So has there been a loss of coping mechanism?
I think coping mechanism is something that depends on every individual. It depends on me as an individual, as an adult, as a professional. আমার কোপিং মেকানিজমটা কি হতে পারে, আমি কি পরিমাণ সহ্য করতে পারি। এখন এটার একেবারে নির্ভর করে যে আমার মানে সোশ্যালি আমি কিভাবে কনস্ট্রাক্টেড হয়েছি। So in that respect, I can cope with a certain level of stresses as a professional because I deal with a stressful job all the time. So I might have a stronger coping mechanism, whilst my family members or even within my profession, my colleagues may not necessarily have the same coping mechanism.
Absolutely.
This is something that goes right the way from children to adults, from professional background to non-professional background, from communities who are less fortunate in terms of dealing with these things, who are able to have a social contact, and those who are not able to have social contact through virtual medium. So it depends on all of those things. I mean, when I work with children, I see children with some of my young children that I work with. They are completely blasé about it. Some will say, "Oh, this is not affecting me at all," and I see that in the children when I'm actually dealing with them. Others, I see the way they are affected. So when they're affected, it has impacts on their psychological beings, it has impacts on their physical beings, it has impact on their relationship, it has impact on their education. So it's important that we understand যে আমরা সবাই মানে অনেক রকমের মানে কোপিং মেকানিজম এখানে অবলম্বন করতে হয়, করতে হবে।
এক এক রকম।
এক একজন এক ভাবে আমরা এফেক্ট হই।
যারা ধরেন সে ফর এক্সাম্পল অনেকে আউটডোর অ্যাক্টিভিটিস করেন, জিম আছে এটসেট্রা, যেমন আমি আছে 7-8 মাস নিজেও যাই না জিমে। হ্যাঁ, বা আমি চেষ্টা করি বাড়িতে একটু করার, কিন্তু অনেকের ধরেন এই সুবিধাটুকু তো না থাকতে পারে, অনেকের সেই মোটিভেশনটাও না থাকতে পারে। কারণ জিমে যারা যায়, আউটডোর এক্সারসাইজ অ্যাক্টিভিটিস যারা করে, নানা কারণে অনেকে মনে করে যে বন্ধু বান্ধবের সাথে দেখা হবে, আইল গেট মোটিভেটেড বাই মাই classmate, group exercise class হোক, gym buddy হোক, etc. In terms of children, families, so you did mention before, they're unable to socialize, although they're socializing virtually. We'll talk about later on কিভাবে আমরা মানে আমাদের মেন্টাল হেলথকে লুক আফটার করতে পারি, বাট যে কোপিং মেকানিজমটা যে মানুষের মানে লস হয়ে যাচ্ছে ডিউ টু কোভিড, সেটা নিয়ে আরেকটু যদি আপনারা এক্সপ্লোর করেন।
I think
you more or less summarized, বা একটু বাংলায় আর একটু আমার দর্শকদের জন্য, কারণ অনেকে ধরেন যারা ধরেন মোটামুটি, I don't know, it's very difficult to kind of generalize, and it's also difficult to kind of, like you said, everybody has their own way of dealing things and their circumstances, their family circumstances. Some people, big family, they deal even better within their family. Some families, if there is a joint big family, they're not dealing so well, কারণ overcrowding হোক, যে কোনো কারণে personal space এর কারণে হোক।
This is interesting, but can I just say, while the society is going through, the whole entire world is going through pandemic, we got to also understand the new emerging issues, which we know, the Black Lives Matter movement. We know the brutality that Black and ethnic minorities people experiencing throughout the world, especially in Western society. We know the recent debate taking place about free school meals. You know, the government is hesitating to put 90 million pounds to help people, help children, those are lacking of proper nutritional food. And if this is not, these are also things that actually adding in relation to mental health. So when we are talking about coping mechanism, এই কোপিং মেকানিজম এটার জন্য আসলে এটা আমাদের সামাজিক সমষ্টিগত ব্যাপার, এটা কিন্তু আমাদের একান্ত নিতান্ত পার্সোনাল ব্যাপার না, এটা রাষ্ট্রের ব্যাপার, এটা সমাজের ব্যাপার, এটা আমাদের ইন্ডিভিজুয়াল সমাজে যারা আছে আমাদের সবার একটা দায়িত্ব আছে। আমরা জানি যারা vulnerable, আমরা জানি যারা ক্ষতিগ্রস্ত হচ্ছে থ্রু দিস কোভিড-19, আমরা কিভাবে একত্রে হয়ে একসাথে কাজ করে সমাজের ভালোর জন্য দুর্বল যারা সমাজে তাদের দিকে আমরা কিভাবে অগ্রসর হয়ে যেতে পারি সাহায্য করার। এইটাই হচ্ছে আমাদের কালেকটিভ অ্যাপ্রোচ। কালেকটিভ অ্যাপ্রোচ ছাড়া আমরা কোপিং মেকানিজমে ইন্ডিভিজুয়ালকে সাহায্য করতে পারবো না, এটা আমাদের সবার দায়িত্ব।
এখানে আমি একটা বিষয় অ্যাড করতে চাই, যে আমার এক্সপেরিয়েন্সে আমাদের সমাজে আমরা স্বাভাবিকভাবে যে মানসিক সমস্যায় আক্রান্ত হওয়া, এই বিষয়টা আমরা স্বাভাবিকভাবে মেনে নিতে চাই না, বা মেনে নেওয়া আমাদের জন্য খুবই কঠিন হয়ে দাঁড়ায়। যার ফলে এটা আরেকটা বিষয়, যে আমি যদিও মানে মানসিকভাবে আক্রান্ত হয়েছি বা হচ্ছি, এটা কিন্তু আমরা মানতে রাজি না, হ্যাঁ, অ্যাকসেপ্ট করতে পারি না। কারণ হচ্ছে যে মেন্টাল হেলথ যখন মানে এই বিষয়টা মানে সামনে আসে, তখন আমি এটা কেমনে স্বীকার করব যে আমার মানসিক অবস্থাটা হয়েছে, এফেক্টেড হয়েছে, যার কারণে অনেক সময় ডাক্তারের কাছে যদি যাইতে হয় বা গিয়ে পরামর্শ নিতে হয়, ওই যে টাবু সাবজেক্টের কারণে, যেহেতু এটা আমাদের সমাজে একটা টাবু সাবজেক্ট, আমরা এই সমস্ত মানি না বা মানতে চাই না, যার ফলে গিয়ে এই বিষয়টা আরো মানে মারাত্মক দিকে গিয়ে আমাদেরকে এফেক্ট করে। Until and unless you are able to seek help from professionals, some aspects of mental health is not going to be dealt with quite easily. There are lots of things that you can do. On a light level, you can go out and exercise. Sort of meet people on virtual and deal with your sort of mental health issues that are affecting you. But sometimes it's much more deeper than that. So তখন আপনার মেডিকেল সাহায্য বা প্রফেশনাল সাহায্য নিতে হয় আমাদেরকে, কিন্তু আমরা যদি ওইটা মানি না, মানতে রাজি না হই, তাহলে বিষয়টা আরেকটু সেভিয়ার হয়ে দাঁড়ায় আমাদের জন্য। এটা একটা
অনেক ধন্যবাদ।
হ্যাঁ।
Yeah, thank you so much. My next question is to Dinar Hossain. How the impact of the COVID on mental health affecting some groups much more than others in the UK? You both touched it. As we go along, obviously, আমাদের আলোচনায় এটা ওভারল্যাপ করবে, কারণ যেহেতু আমরা somehow আমরা aware of যে a group more than other group are more impacted for various reasons. So, Dinar, do you want me to repeat the question, or you got it?
How it impacts on others?
How the impact of the COVID on mental health affecting some groups much more than others in the
Sure.
UK.
Thank you. As you said before, আমি হয়তো একটু প্রথমে আমি একটু highlight করেছিলাম আর কি. So if you look at our society, those are vulnerable, those are coming from disadvantaged background, those are sharing apartment with number of family members in social housing condition who doesn't have. They don't have that kind of privilege opportunity like others, having a garden, having a bit of a fresh air, and so on. They will have significant impact than some others in the society. And I think we need to be mindful of that. We already know the death rate. If we analyze, we see the death rate among BME is disproportionately higher than any other communities. We have seen from the professional point of view in medical, in the NHS, as well as we have seen the death rate among public. And it's very, very disproportionate. So we know that people from Black minority ethnic groups are significantly affected. We also know that people from vulnerable groups are significantly affected. If you look at some of the inner London boroughs, for example, you will see increased rate of county lines activities going on among disadvantaged children and young people, because some people, those are privileged, having to be sitting down in lockdown stays, who are out and about supplying the drug. And unfortunately, these are the vulnerable young people becoming a victim of county lines, gangs strategy. And this is what that's happening to them as a result. And we also know that some of the young people, those are coming from disadvantaged and disaffected background. I already mentioned that to you earlier on. They don't have opportunity like others to sit in a virtual classroom in their room. They don't have the computer and logistic and virtual facility available. So these are the cohort that we need to start looking at. I also indicated, as you asked Hashi earlier on, about people losing their jobs. Well, those people are already living below or similar to minimum wage or working wage. They are the one, unfortunately, likely to have a greater risk in terms of losing
and
jobs.
Those are the people who are traveling by bus. Those are frontline
and becoming
those
unemployed.
Working manual labor. And
absolutely. So if we look at all these ways,
key workers, etc.
We are able to see there is a clear segregation the way the COVID-19 affected our society as a whole. If you look at disadvantaged and vulnerable groups, and if you look at those are rich and privileged group, the data and research will tell you those are affected.
I'm not sure whether you guys had a chance to look at. There has been a research actually, although it's completely different issue, because we can talk about the issue in another show.
Sure.
If we have opportunities, but it's about structural racism. There was a report study done by Sunimit and IPPR. If you have a chance, have a look at that, because we can't go into that discussion now. It's completely different.
Is worth of mentioning. Those young people are on free school meals. We are the 6th richest nation in the world. Are we saying we cannot fulfill their needs for a week while they are on holiday, when the school has been shut down for 6 months? They didn't provide meals and so on for 6 months to vulnerable young people. We are talking about a school holiday, and we just happen to be our celebrities. And I respect, well respect to Rashford, well respect to Raheem Sterling, who are coming out openly and campaigning to support these vulnerable young kids. Those are living below poverty level, where parents cannot afford to give them proper meal, like most of us do have opportunity to have meal, but they don't have. And we are failing, and we are significantly failing our society. We are significantly failing our disadvantaged and vulnerable young people and vulnerable communities. And if we do not reach out to them, unfortunately, one can only think about what kind of society we are living in. Where is the passion? Where is the compassion?
A obviously will impact on our mental health. Definitely.
Absolutely.
Yeah,
Absolutely.
that is the key. Okay, next question to Khurshidul Haque. Is he here with us?
Yeah.
Okay. The high level of stress associated with the pandemic is making people more vulnerable to depression and anxiety. Do you agree? I mean, we are discussing them over and over, but this is quite
absolutely.
precise.
Without a shadow of a doubt,
Stress,
yes, stress. Because we talked about sort of individuals
I mean,
being
before
affected.
you go into discussion, shall we have a look quick statistic so that
Yeah, absolutely.
yeah,
Go on,
you can
go on.
contribute?
It would help us
Yeah.
in our discussion.
So, yeah, according to Office for National Statistic, we are all aware of that. Yeah, more than 2/3 of adult in the UK, which is 69%, actually report feeling somewhat or very worried about the COVID-19 is having on their life, the impact having on their life. The most common issues affecting well-being are worry about the future, which is 63%, feeling stressed, and that was my question, or anxious, 56%. So that is quite significant. It's over 50%, and feeling bored, 49%. So let's talk about stress, and that was the question.
Okay, so
we had a chance to look at this statistic, and now we can move into discussion.
The figure speaks volumes, right? People in general, like I said, we have to look at the way we have been constructed by Allah subhanahu wa ta'ala, and the ability to cope for each and every one of us. So on a general basis, every single person are affected by everyday life of stresses, everyday life of anxieties, on a daily basis. But this is something far and beyond the stresses that we're having to deal with, on a daily basis. If I share one of my personal sort of anxieties, in terms of the initial stage when we faced this pandemic, and we had the shortage of um, uh, the ventilation, for example, and the coping mechanism, or the coping ability by the NHS. We all know what that was. We all know how that was sort of had that affected, right? The fact that we had to sort of build Nightingale hospitals throughout the country, right, because of the coping mechanism, or rather NHS not being able to cope with the sort of impacts and high rates of hospitalization and so on and so forth. I've always thought, as a nation, that we could face with any challenges. So the reality was, when the test was put to us, that we didn't cope. We weren't able to cope, with such pandemic situations. So if we would take that on board and the scale of it, on an individual basis, if we bring it down to individual basis, how do we propose that individual cope with such a bigger impact? as COVID-19. It's impossible. And so, therefore, it is absolutely imperative that we understand the level of stresses that we're all faced with, and how we are coping, or individual are likely to cope with. We are not going to cope with these things. Absolutely no way. And if we look at the statistics, right? But these statistics would have been completed for the last 6 months. If we stick on this point for a moment, right, and think, how is the next 6 months going to impact on us? Just imagine, the
Now that we're
way.
on second wave, which is
Exactly, which was something throughout the news, which was something that was said by sort of medical professionals, the expertise that we would have. But have we really put in strategies to cope with? That is another issue. I mean, I don't really want to go into that because that's for the
absolutely,
government to deal with, right?
yeah,
But we're not here to sort of either criticize, or talk either for or against. But we need to ask ourselves, have we really, on an individual basis, prepared for that? I think if I were to talk about myself, I've always thought that we were going to have a second wave, or we would face what we're facing now. But that's me as an individual. Maybe I've been able to have access to a lots of information and professional debates and discussion, hence the reason I'm prepared in my head, that I need to be prepared for things like that. There are many people, right, community people in general, are not sort of geared to think like that, and so therefore it doesn't affect them in that way. They don't have to think about these things. However, the reality is, it is impacting on them. So the next
perfect.
six months, is going to be crucial in terms of how people deal with stresses. We were told to work from home, then to go back to the offices, right, where we can. And now we're told, don't go back, right? So
Or if you can go back, or if you can't, very confusing
yeah,
messages.
absolutely, all of these things. If these kind of stuff are having impact on us as professionals, on a general basis,
Definitely,
on a general
definitely,
basis, a lay person, how is the impact going to have, or how is that going to impact on them, is what we need
absolutely,
to imagine and
absolutely.
understand.
Absolutely. I mean, if I can share, I shouldn't be, but I'm in the same boat. I've been working last several months from home, but now we are all public servant here today. And I have been told from November probably we have to start blended work, because we are all given a Surface Pro. Some of us will be working from home on a weekly basis, and then some of us have to go back to work. I mean, they're considering a lot of things in terms of even having contact with your colleagues, see
But
colleagues.
just to going back to the issue that you were talking
Okay,
about,
yeah,
I
yeah.
just want to add what
You
Khurshid
want to
by
add
say.
something? Okay,
We already know the increase in domestic violence.
yeah.
We already
I
know
have I have a question about that. Yeah,
but we already know. No,
we'll talk
I'm
about
just
that.
giving you some of the context in relation
Yeah,
to how it affected vulnerable groups. We already know violence against women is already on increase. And
yeah,
since a school started, it's important to note down that we are seeing now increased take up in social care in very many different local authorities, especially in inner London. We are also seeing increased take up into youth justice system. We are also seeing increased rate of exclusion, because as I said to you before, they are the young people who underprivileged didn't have the opportunity to sit in a virtual classes and so on, due to technical lack of technical abilities and so on. As a result, we have seen increased rate of exclusion, and this will have a severe impact in relation to the way the gangs operates within London boroughs, the way they groom our vulnerable young people, the way they exploit our young people into county lines, and the sexual exploitation. And one, we need to act as a society as a whole to demonstrate that we are united, we are about to work with our leaders, our public health advisors, our scientist advisors, and together as a public service, we need to demonstrate that we are working in an integrated way to maximize the support services for our most vulnerable young people as well as adult in our
Definitely.
communities.
Thank you, Dinar. Next question to you. Unless otherwise you guys want to add anything else, but you always have an opportunity to come back and if you guys want to add. So do
Thank
you think the quality of house people live and their ability to afford housing are strongly influencing on mental health? So you did mention
I
already, you
think, as I
touched it, but I think we need to have a precise discussion on that specifically so that our
as I said to you,
দর্শকরা বুঝে
sure,
একটু. So
as I said
quality
to
of
you,
housing
those
and
Yeah, sure. As I said to you, Afa, before, যে আমাদের সোসাইটিতে যদি দেখেন যারা পভার্টি লেভেলে থাকতেছে, তারা সোশ্যাল হাউজিং এ থাকতেছে, তাদের কোনো গার্ডেনের অপরচুনিটি নাই, তাদের অনেকের প্রিভিলেজ অপরচুনিটির মতো 1 ঘন্টা গিয়ে বাইরে গিয়ে এক্সারসাইজ করার অপরচুনিটি নাই, তাদের জবের সার্টেনিটি আছে কি না আছে এটা নিয়ে কোয়েশ্চন, এক্সারসাইজ তো দূরের কথা। তাদের অনেকের ফার্লো স্কিমে ছিল, কিন্তু এরপরে বিকজ ইন্ডাস্ট্রিতে সিগনিফিক্যান্ট ইফেক্ট হয়েছে, তারা জব লুজ করতেছে। আমি আপনাকে আগেই বলছি 5 থেকে 7,000। এবং কোয়ালিটি হাউজিং যেটা বলছেন আপা, এটা একদম ইম্পর্টেন্ট কোয়েশ্চন, বিকজ when you have absolutely অনেকের ব্যালকনিও নাই, you got 2-bedroom 3-bedroom house, when you got an increased rate of domestic violence going on. I'm not generalizing it, I'm just giving you a picture. That's right. When you go overcrowded housing condition, when you are asked that you got to be locked down, how is it possible for this group without providing additional support? They are supposed to be locking down. How 17 years old, 15 years old, 13 years old siblings with parents and elderly people, as already Khurshid Bhai mentioned, in terms of extended family, how are they supposed to be sitting indoors without any social interaction, whether virtual or face-to-face?
Do they even have a space to self-isolate? That is the big question, and this is
the question. This is the question.
We could what was recommended by. Sorry,
This is why one of the reasons.
One at a time. One at a time. Who wants to go first?
Right. I just want to add to this again. You know, I keep go back to the whether it's new normal or what we are or the way we have been constructed to live our life. It is quite normal to live, the life we have been living pre-pandemic. We get up, children go to school, we go to work, we come back, we do our exercises, we go out, we shop, we do, socializing, we meet, we gather, we have weddings, we have mosque attendance, we have all of those things. So we are not doing any of that, right? If you touched on domestic violence, for example, the reason why that increases,
we'll talk about. We have a question
specific.
About it,
okay, so if we it's all
we're
about
talking about quality
norm.
housing.
Yeah, I'm coming into that. So the new norm, right? Quality housing, where that comes in, right? It impacts because we have been sort of constructed to live a particular life where we have all of those things that I've mentioned. We're not having any of that. So if we are in isolation, we've got to have the personal space where we don't have the personal space. Those who are living in flats are not able to sort of enjoy those kind of commodities. Therefore, it is having impact on our everyday life, on our personal relationship, our relationship with partners, our relationship with children. The impact on us as individual is also greater as well. So all of those things, right? It's the new normal that we're having to cope with. That is what is something that we need to highlight, is that is this something that we're going to be continuing to face, and how long is this going to go on for? is something that we need to be mindful about. We're not coping with this, right? Social housing is impacting on us because, two bedroom, three bedroom with an extended family, large sort of number of children are impacting on all of these things. It is inevitable that these things will be impacting on us.
Yeah. Just to add on to what you've just said, there has been another study done by according to Office for National Statistics. Just to add to you guys what you've just mentioned, during lockdown, people have spent more. Sorry, Shabaj. Okay, yeah. So we just have to be quite quick. Actually, 1 hour.
Right. Just one more thing I just want to add.
Yeah.
Financial sort of implication has been an issue as well, on the basis that people are losing jobs, but people are spending more. Where you'll probably say, well, how are they spending more if they're not going out? There, if we look at the online shopping, that has increased. That is increased due to boredom. So
Yeah, absolutely. People are stuck at home. People have to do something to kind of
absolutely,
feel good.
yeah,
Either it's
precisely,
food
yeah.
or clothes or yeah.
Yeah, and people, I've seen people, even within my sort of household, online shopping has increased to a significant high, because let's order something online, something that you don't necessarily need. That has
Yeah,
financial implication, right?
obviously.
In the same way, it has sort of impacts on sort of people who don't have the finances. Um, Thus, it also has implication on sort of family arguments. That then, it's a snowball effect that then has impact on other issues. You
Yeah.
have child protection issues, then you have domestic violence issues then as a result of all of these things.
Definitely. I just
Because
wanted to come back to the overcrowding bit, and I just wanted to share this statistic with you, guys. For example, like I said, according to the Office for National Statistic, 1 in 8 households, which is 12% in Great Britain, have no access to a private or shared garden, which we have talked about, and specifically. Black people in England are nearly 4 times as likely as white people to have no access to outdoor space at their home, which is 37% versus 10%.
Absolutely.
So
and that,
that is the
that
key. And yeah,
and
so
that is
let's have
due
a
to
quick
their.
discussion on this, and then we'll move on to next question because
Yeah,
we're
and
running out of
that's
time.
due
Yeah.
due to their sort of income, their social lifestyle, their overall lack of income. The kind of jobs that they hold are not able to buy a property or a house. At a sort of place whether they can afford that. So
But
all of this.
what does statistic implicate here in terms of black and ethnic minority community? Why is so much difference in terms of stats? 10% versus
Well,
30.
it's one of the conclusive remark from what you just stated about the black and
I
ethnic
have any
minorities.
according to this statistic.
Yeah, exactly. That's what I'm trying to say. What you quoted, what it says very clearly, and I've been saying all along, that through this pandemic, COVID-19, people are from disadvantaged, people are from vulnerable background, people are from BME background, are significantly impacted through COVID-19, through this pandemic, than any other communities. It's been well evidenced.
And this is something needs to be addressed, doesn't it?
Absolutely,
think
but
it's
this
about
this has to
time
be this has
we
to
need
be
to talk
addressed through
about it.
our
And
it has to be addressed through our democratic process that we already have, a stringent democratic process. But at the
Yeah,
same time, we also need to look at how we can collectively work together. It is not a party issue. At this moment, free school meal is one of the good examples. How can
yeah.
our MPs, elected MPs, taking this away from our most vulnerable young people who are not able to afford their school lunch during the lunch? I mean, this is unbelievable. We are the
so
sixth
in
And
richest nation in the
in
world. and
Yeah.
we can't give those are very, very vulnerable young people. We can't feed them properly. What does this say
Absolutely.
about our society?
Yeah. So in those kind of situations, once we can sort of you know divide the different communities in different boxes and different compartments, when it comes to sort of a national level unified approach, if we look at sort of providing lunch, I don't think we're talking about particular sort of vulnerable communities. I don't think we're talking about particular
No,
communities
no, no.
here.
The question was about overcrowding. So I think, yeah, let's move on to next question because we are running out of time and we need
Okay.
to kind of catch up. And you guys, both of you touched, it was about domestic violence. So as we know, according to this statistic, domestic violence kind of double upped. We know that. And the question was to Khurshidul Haque. Uh, During COVID-19, domestic violence has risen sharply due to people staying indoors under enforced lockdown. How is that impacted on people's mental health? So you did touch, both of you, but if you want to briefly discuss, let's have a quick discussion. Both of you can
It,
contribute, and then we'll
yeah,
move on.
I mean it's one of the things that in our job, in my job, I mean we've seen the rates of referral has gone, it's gone rocketed, rocketed, and as Dinar Bhai sort of mentioned already, he mentioned county lines. I've recently sort of left a job, working for CSE team and CE, so which is child exploitation and child sexual exploitation team. County lines is one of the issues, right? So yes, it's impacted on the lives of women hugely, and all the things that we've discussed has had impact on these, and as a result of that, it's impacted on domestic violence. It's impacted on the number of referrals that we've seen in terms of child protection, for
So
example.
definitely, I mean, domestic violence has greatly contributed to people's mental health. Obviously,
Without a shadow of
without
doubt.
a doubt.
So,
Okay.
COVID-19, mental health, child protection issues, all of those things are very, very important, that we need to understand how and why it's sort of increased. And, the governmental departments are doing or looking into sort of dealing with all of those issues without a shadow of a doubt. But, what we need to be mindful, we're in a situation where we're having to deal with here and now, and that's what's important at this moment in time. We are dealing with here and now. What needs to happen in the specific areas, will need to have a unified approach for us to look at each and individual communities and individuals, and how we can deal with those issues.
Thank you so much. Next question is, I have to quickly kind of run through all this question so that we catch up on everything. শাহ ভাই, আপনাকে অনুরোধ করছি আবারও যদি কাইন্ডলি আমরা we are overrunning as usual, আমাদেরকে আরো একটু সময়, যদি শাহ ভাই অলরেডি আমাকে মেসেজ করেছে, আমাদেরকে আরেকটু সময় অ্যালাউ করুন, আমরা নিয়ারলি কাছাকাছি চলে আসছি, so that we can wrap up nicely. Dinar, next question to you. Evidence from yeah, he's got another show. So evidence from past outbreak as well as from this pandemic indicates that we are likely to see an increased mental health in frontline health and care workers. Please discuss frontline health workers. So we are stick to this.
And this is why
Yeah.
I personally believe that the experience that we faced as a nation, especially our frontline workers, and frontline worker doesn't necessarily only mean those are working for NHS. People are working for
Absolutely.
supermarket. People who
Any work is frontline.
people who working
When
people
dealing
who
with
working
public and you are
people
facing
who are working as a cleaners, people who are working in the social care, people working in the
Absolutely.
care homes. So what I'm trying to say, I'm hoping and I'm praying the negative experience that we had in March and April at the beginning of pandemic, because and we can't blatantly blame on government for this. Let's be honest, no nation on the planet were ever ready for dealing with this kind of
No,
global pandemic
no,
issues.
absolutely not.
So
Well,
I'm
this is
hoping-
unprecedented,
I'm,
obviously.
I'm just hoping and I'm praying that we have learned through that process and our democratically elected government will be able to apply right measures, right procedures in place to ensure that our frontline services are preserved, they are protected through PPE, and they also been looked after through counseling and other associated support services available to them.
Test as well.
And I feel positive about it because I already feel that the government has taken a step forward to make sure that we reach out to protect our frontline workers, to reach out to protect our vulnerable children and young people. I just hope they go further in relation to free schools, meals, and so on, because this coronavirus is not going to go away very soon. It's going to go stay with us for a while to come, and we need to be ready, and we need to have a collective approach to work with opposition and the government, as well as public, society, community activists, NGOs, and all the voluntary sectors working together to ensure that we maximize the support services for the society as a whole, for the betterment of the society that we live in. Thank you.
Did you wanted to add something?
Yeah, I think it's important that we sort of understand the discrimination and the racism faced amongst the Black and minority communities, and as a result of that, we need to evaluate that as well. It is imperative that we look at those issues and address those issues. Yes, as Danabai said, that the government and the elected members are doing all their very best to address those issues, but it is crucial to understand each and every community that we have in our societies and how they are sort of impacted by these is looked at. And if it's to do with decision making, if it's to do with policies, if it's to do with racism, if it's to do with the discrimination or any other oppression, that impacts those vulnerable communities, we've got to address those issues as well. This is not going to go away, and if it's not addressed appropriately, shoving it under the carpet will not resolve any issues. It is vital that we are open, we're honest, and we have a collective approach to deal with any issues. It is most important that we take into consideration the Black and minority communities, because we have seen, there's been sufficient statistics available how the COVID-19 impacted, sort of Black and Asian communities, and as we've touched, the professional medical professionals have also been sort of impacted as well. So we've got to deal with those things. There's been a number of researches, there's been a number of discussions and topics on TVs that we've all had and sort of seen and listened to. We've got to take that onto on board and take into consideration when we come to find solutions.
And just to add one line to Khurshid Bhai, what Khurshid Bhai said, rightly so, and Hashi have also indicated earlier on, please maintain PHAC guidelines. There are scientific research and evidence being carried out to make sure that we all follow the guidelines, the tier system being established, tier 1, tier 2, tier 3. Please go and understand it, and please follow government advice.
And you have to take some responsibility as well to look after
we have
ourselves and our
to. We have to. Please maintain social distancing wherever possible. It's not possible throughout all the time. I certainly travel by public transport. I can tell you categorically, social distancing is not possible to maintain. No. But please wear mask. Until you are exempt from medical evidence, please continue to wear mask. There are reasons behind
Wash your hand, do what you can do.
And so on. Yeah. Please maintain all the guidelines.
Thank you so much. I have to move on to next question, guys. Sorry to stop you. Next question, I think we can skip actually, if you do agree. Well, the question was to Khurshidul Haque. Does job and financial losses causing immediate impacts on mental health? I think we had extensive discussion on that. We can easily skip. You agree?
Yes,
Shall we
It
move
does.
on?
yeah,
Certainly.
definitely.
Okay, next two question is
I don't
next.
think Khurshid and I disagree at all. I mean, in
No,
relation
we
to
haven't.
discussion,
But still, it's a discussion, so we need to
of
feel
course, of course,
comfortable, and we need to
Sure.
kind of cover everything.
of
Okay,
course.
next question was to Dinar, and both of you can contribute. Like I said, access to mental health service are critical for people experiencing mental illness. Has access to mental health service been reduced? If so, how does it impact on the services? So you guys
I,
already mentioned about your services, but
I just
in general, please have a quick discussion
I just,
how.
from my experience, I will just mention, I'll just give one example.
Okay.
We hope that we rectify from some of the mistake we have made through that process. As I said before, no nation in the planet were ready to deal with this kind of pandemic global issues. However, we have learned quite a lot of things. One of the good example about test, trace, and tracking, I hope the government started devolving these issues to local government. This particular the whole concept of test, trace, and tracking, where local government is very much in touch with their local people. They have a good, close relationship. We could have made it very successful, and hopefully we will make it very successful. I don't want to say we are not going to be successful. It's very early stage, but
Has the access to mental health services been reduced?
I think it is important. It is important that we need to sort of state very clearly, Dinabai, that yes, it has. And if I sort of use an example of CAMS services, so child, adolescent mental health, for example, the referral has into that
it's increased,
sector.
rapidly increased.
It's increased, and so therefore it has become the provision has become less, the not because the service itself has decreased, but
But it's
because the
become
number of
stretched.
referrals, yeah, it's been stressed.
I would say we
Without a
need
shadow of
to,
a doubt,
yeah,
that has impacted. And in the same way, adult mental health sector has also suffered in the same way.
I
If
would
you think about
say
it,
any service that you provide for vulnerable people, please stay away from centralizing it. Decentralize the services so that people in their locality can access such services when they are suffering most. We know data, we know research suggested where
So
domestic violence
we
is high, where
agreed that
poverty
the
level is high.
service has been
Reach out
reduced.
the services to them. No, don't do
Yeah,
it from central
Dinar,
basis.
we
no,
agreed that
I know,
Decentralize it.
yeah,
but
we
we
agreed that
agree.
service has been
Yes,
reduced, and if so, how is it impacted? So service now we know is reduced, and how is it
But
impacting
that's
on
why
it?
I think it requires to follow some of the strategy already in place. And I indicated
Okay,
earlier on
yeah.
early help, bright
Uh,
start, targeted
uh,
support, social care. We all need to work in an integrated way, including our emergency service enforcement agencies, as well as our ambulance services, as well as our NHS services. We all need to share information, collectively work together to maximize the support services for our citizens in this country, but at the same time to make sure
yeah.
that we protect, we play a proactive role together collectively, and make sure that we all have a vital and
Sure.
equal responsibility to
Thank
play.
you, Dinar. And I just wanted to touch, you guys, you will have your opportunity to say, I just wanted to look at this statistic quickly in terms of reduced service and how it's impacted. According to NHS providers, service were already stretched well before the pandemic. We know that. With many providers reporting on inability to meet the demands
yes.
rising prior to the pandemic, and lockdown is adding pressure that is likely to increase in future. And there was another study by the Royal College of Psychiatrists report. Oh, not study, it's a report, yes, study as well. Okay, almost half of the psychiatrists have been increase in urgent and emergency cases during lockdown, but also that a similar proportion have seen fall in routine appointments. So we know why there was a fall.
And that
People
is
are
the point.
scared. People are not going to appointment.
Yes,
Hold on for a
yes.
sec. Let me just finish this. Yeah. So there are fears. People are staying away until they reach crisis point,
Mm.
which will result in a flood of exacerbated and untreated mental illness. After the pandemic and And mental health providers are already reporting significant increase in demand and severity of new referral. So the Charity Mind has found that almost a quarter of people who tried to access mental health service during a fortnight in April failed to get any help. So that says is all, basically.
Exactly, and that was
Yeah.
my point,
Sorry, so now
Hashi.
discuss, yeah.
Yeah, that was my point. So if we look at adolescent mental health, if we look at sort of adult mental health, if we look at Mind as an organization who are stepping into, in terms of their kind of roles and responsibilities, every sort of angle we look at it, right, the services has overstretched hugely, and that is not going to go away. I mean, if I use an example of a personal situation, I've had medical sort of appointments that I should have had at my hospital appointment, a physical hospital appointment. On a number of occasions, I've had a discussion over the telephone with consultant, and one of the consultants said, well, pandemic will be over and you'll be offered an appointment within 2-3 months. I'm 6 months down the line, I'm still waiting. So and I don't want to sound, sort of bigoted about it, and I'm not. If we think as professional we're able to sort of cope and manage these kind of situation, right? Layperson in that kind of situation are not going to be able to cope and manage. There's also additional sort of pressure of the fear. If I go to the hospital, what
Absolutely.
will
I mean,
happen?
those people are, we've seen on the news, people are terminally ill. They're waiting 8 weeks for blood tests. People considering to have privately done blood tests
Yes,
as
yeah,
well. So there is
yeah.
backlog, and I mean, all of these, obviously, we are kind of আমরা ধারণা করে নিচ্ছি যে মেন্টাল হেলথ আরো খারাপের দিকে যাবে।
হ্যাঁ,
এবং
অবশ্যই যাবে। রুটিন
এটা
রুটিন যে সমস্ত অ্যাপয়েন্টমেন্ট,
হ্যাঁ,
রুটিন অ্যাপয়েন্টমেন্ট গুলো আমাদের যে সমস্ত মানে রুগীরা আছে, রুটিন অ্যাপয়েন্টমেন্টে ওরা যাইতে পারতেছে না। বিভিন্ন
যাচ্ছে না ভয়ে
যাচ্ছে
বিভিন্ন
না,
কারণে
যাইতে
সেগুলি
পারতেছে
তো
না, মানে অ্যাপয়েন্টমেন্ট পাচ্ছে না। যাচ্ছে না বয়ে, কারণ যদি হাসপাতালে যায়, প্রত্যেকে জানে যে হাসপাতাল গেলে ওখানে মানে করোনা ভাইরাস থাকতে পারে, ধরা পড়তে পারে। যদি আমার কাছে ট্রান্সমিশন হয়ে আসে, তখন শুধু আমি না, আমি আমার হাউস হোল্ডে আমি হলাম ব্রেড উইনার। আমি যদি এফেক্ট হই, তাহলে আমার পরিবার এফেক্ট হবে। আমার
absolutely
পরিবার যদি এফেক্ট হয়, তাহলে if we look at a wider sense, আমার দেশে বাড়িতে আমার যে সমস্ত আত্মীয় স্বজন আছে তারাও এফেক্টেড হবে। So it's a
definitely
huge issues, হ্যাঁ, that we're facing in terms of dealing with these kind of stuff.
This is why it is important that we follow the guidelines accordingly to reduce the rate of spreading the rate of virus, at the same time to reduce hospital admissions. If we continue floating about the roles already been imposed, been advised to us to maintain, then unfortunately this virus is likely to increase. The rate admission in the hospital is likely to increase. Another one, people with other severe difficulties, mental health, and other different severe problematic underlying health condition they are going through, they will not be able to have easy access because our capacity will be more than full. And as a result,
part of which requires immense level of education and educating the people. Once you and I accepted, you've given an example, when you travel on public transport, right? The risks involved. You wear a mask,
guys,
right?
I'm sorry, we just need to be I'm getting message from Shabai. We've got another show coming up,
Okay.
so we just next show they're almost ready, so we just need to kind of wrap up. So I'm
Sure.
moving to quickly next question. Next question was I think we can actually skip this. As we all are aware, we know that mental health experts are saying we may also experience a second wave of mental health because we have already second wave of pandemic issues relating mental health. So I think we've discussed that we can skip that. So we are now to our last question, and this question is to both of you actually. How do we look after our mental health during COVID? And you guys touched it. You've said very, very important point you raised in terms of how we can manage, etc. But what do you think? Firstly, Dinar, and then Khurshid, and then we'll try to
Thank
wrap up.
you. Thank you.
Yeah.
We
So,
are talking about mental health,
how do
and
we look after our mental health
sure, and we must
during this
understand.
pandemic? Yeah.
Sure. We must understand mental health is not only a prescribed service. It is a service that has a responsibility to look out for each other, look after each other, listen to each other. We support our community voluntary sectors where people can go and freely talk to each other. We open up our public services that are able to deal with people with mental health and so on. But at the same time, we also, as a responsible citizen, as an individual, we have a responsibility to look after our loved ones, our relatives, and people those are vulnerable. The only way we can do that, maintaining all the guidelines, listening to each other, and that's the way we can provide greater support. As I said, mental health must not be categorized by only a clinical service. It is not. It is a support service. And if you are talking about support service, then it is a collective approach between government, between people, between voluntary sectors. We all have equal and invaluable role to play to make sure that we reach out to each other. Not only vulnerable are affected by mental health, I must say, people also affected, rich people, everyone affected by mental health.
This could be anybody, because this is unprecedented. We're not prepared for it.
Exactly. So the only way, and people often make a mistake, they only think it's a social care service and it's only a prescribed service and it's a clinical service. It's not. It's a supportive service. We need to reach out. We need to give time to listen to each other. If we cannot have a face-to-face contact, make sure that we do talk to our vulnerable ones. We do talk to our loved ones. We do talk to our relative ones. So in that way, we give time to listen to each other. We offer our shoulder to cry, for someone else to cry on. And this is how we do things. We have to collectively work together. We have to maintain public health guidelines. But at the same time, we have to be passionate, and we have to understand that through that unusual, very, very tough, difficult times that we are going through, if we do not reach out for each other, there is no ways of combating this problem only by the government. It has to be a collective.
Thank you so much indeed, Dinar. How about you, Khurshid?
I think
how do we look after our mental health?
Dinar has done seriously justice to the questions. Yes, it is. It's not sort of a service that needs to be provided by a particular department. It's a collective sort of effort. Everyone needs to look out for each other. More importantly, I think we need to have a positive mindset, positive outlook, that we would, sort of fight the pandemic. Even in mental health, if we look at the positive mindset, significant sort of changes can take place. So it's all about keeping in touch.
How about keeping in touch with people, keep active, eat well.
I'm just coming onto that. So keeping in touch with individuals, keeping in touch with relatives, sort of making sure that you sort of take out time for exercises. You sort of make sure that you call people on a regular basis. Like Dinamai says, if you don't have facilities for virtual communication, you can phone and speak to people. You make sure that you sort of go to the local masjid, for example, and meet the vulnerable people. In fact, that they're not sort of able to come, but find out who those are. Offer any sort of help that possibly can, something that we're already doing sort of locally here in Birmingham, for example. So reach out to people. That's what's important. It is about reaching out to people. It's not about sort of saying, right, it's the government and the politicians and the elected members who needs to do everything. We have a role to play. Every one of us have a role to play in order to reach out to people and to
looking after
sort of help and
ourselves. Yeah.
support them.
It's active citizenship that comes with love, passion, and
Precisely,
care.
yes.
And
Yes.
that's what we need to demonstrate to each
Yeah.
other, to the wider society.
Absolutely.
Yeah,
I
and-
mean,
and
we
when-
have to take some responsibilities of
Yeah,
our own.
more importantly, for people like you and me, and you, Hashi, right? Dinar Hashi, we all have our job sort of doubled, if you like, in the sense, because we represent not only the department that we work for, but we also importantly represent the communities that we live within, and we've got to not only to say that I will do it from my professional point of view. No, that is not good enough. We have to go out of miles in order to do that, and sometimes taking risks, and that is about showing to people we're there for you.
And
it has
also,
to be
like,
done.
you guys mention again and again, we have a vulnerable people in our community, those who can't, those who are homebound. We have a duty to call them every so often, find some time, talk to them, ask them how they're doing, do they need any help, any shopping, etc. Even
And
leave the shopping doorstep, ask your
Yeah.
neighbor how they're doing.
Absolutely. And
Absolutely.
it's about, regardless of race, culture, background,
Absolutely.
anything at all.
Anything.
It's our society. We all have responsibility to make our
Yeah.
society a better place to live. We need to follow the guidelines. We need to follow our government rules and regulations. We need to work together collectively to make sure that we maximize the support for all of us, because we all can be vulnerable. No one is free from COVID-19, and
No.
that's what we need to be careful.
No.
And that's
And it
why we
doesn't-
all have responsibilities to play.
It doesn't. What we need to understand, it does not discriminate. COVID-19 doesn't choose black, white, yellow, green, whatever, men, women. It doesn't. It does not discriminate. That is a fundamental thing that we need to be mindful. It could happen. It could get to anybody, and so
What a
therefore,
wonderful way of ending our program today. Thank you ever so much, both of you, for your contribution. Sunday night, like I always say, tomorrow is working day, whether we're working from home or we're traveling to work. Still
I'm
we have some
traveling to work
preparation
tomorrow.
to do. Yeah, but Dinar, always you enjoy traveling to work, You
I love
say
interacting with
you
people.
get to see your
I have the
colleagues.
opportunity.
from home. I'm working from
Yeah,
home.
I'm working from
Unfortunately.
home. I'm on my annual leave actually. I've got another week to go.
Right.
But
Okay.
yeah, so I'm chilling at this moment, but I have other plan. But thank you ever so much. You have especially Khurshid from Birmingham, all the way from Birmingham. And thank you for your contribution, Dinar. Thank you ever so much, both of you. And I hope দর্শক আপনারা এই অনুষ্ঠানটি উপভোগ করেছেন এবং আপনারা আমরা যতটুকু উপকৃত হয়েছি আপনারাও উপকৃত হতে পেরেছেন। আর যেমনটি আমার অতিথিরা আলোচনা করলেন যে আমাদের সকলের গাইডলাইন্স ফলো করতে হবে। We also have a duty to look after ourselves. আমাদের কারোর উপর ডিপেন্ড হয়ে বসে থাকলে চলবে না। আমাদের নিজেদেরকে ভালো করার জন্য, ভালো রাখার জন্য যা করা দরকার সেই দায়িত্বটুকু আমাদের নিতে হবে। আমাদের চেষ্টা করতে হবে আমরা কিভাবে এই কঠিন সময় থেকে পার হয়ে আসতে পারি। সেটা হোক আমাদের ফিলিংস এর ব্যাপার। আমরা যদি কোনো ব্যাপারে মন খারাপ থাকে, অথবা যেহেতু আমরা ঘরবন্দি আছি, বন্ধু বান্ধবের সাথে আলাপ করুন, আত্মীয় স্বজনের সাথে আলাপ করুন, ফেস টাইম যাদের সুবিধা আছে করার, ফেস টাইমে কথা বলুন। যদি পরিবারজনকে, বন্ধু বান্ধবকে মিস করেন, একটু সময় বের করে হলেও, যেমন আমার গেস্টরা বললেন যে উই ক্যান কিপ অ্যাক্টিভ। আমরা জিমে যেতে পারছি না, কিন্তু বাড়িতে হালকা পাতলা এক্সারসাইজ আমরা করতে পারি। পার্কে একটু, লোকাল পার্কে একটু হেঁটে আসতে পারি। আমাদের বাড়ির আশেপাশে যদি একটু গ্রিন থাকে, একটু ক্যানাল থাকে, অনেকেরই ক্যানাল আছে বা পন্ডের মতো বা পানি ইত্যাদি, আমরা একটু ফ্রেশ এয়ার নিয়ে আসতে পারি। আমাদের খাওয়া দাওয়ার দিকেও নজর দিতে হবে, আমাদের একটু হেলথি খাবার খেতে হবে। উই আর অ্যাপ্রোচিং দি উইন্টার মান্থস, আমাদের খাওয়া দাওয়ার দিকে ভালো নজর দিতে হবে, এবং কিপ ওয়ার্ম এজ ওয়েল, নিজেদেরকে অনেক ওয়ার্ম রাখুন। প্রচুর ড্রিঙ্ক করতে হবে, আমাদের করা উচিত, যাতে আমরা নিজেদেরকে হাইড্রেট রাখতে পারি। মোস্ট ইম্পর্টেন্টলি, যদি আমাদের সকলেই যাদের হেল্প দরকার হয়, আমরা অবশ্যই যাতে দ্বিধা না করি সাহায্য চাইতে কারো কাছে, নেইবারদের কাছে, বন্ধু-বান্ধবদের কাছে, আত্মীয়-স্বজনের কাছে। আ আ আমরা কেউ সুপারম্যান বা সুপারউম্যান না। আমরা যদিও বলি যে I can cope, I'm fine. At some stage we all need shoulder. আমাদের সকলেরই শোল্ডারের দরকার হয় এবং আমাদের হেল্প লাগলে হেল্প অবশ্যই জিজ্ঞেস করা উচিত। সো অনেক ধন্যবাদ আবারও আগামীর পথের সাথে থাকার জন্য। আশা করি আপনারা অনুষ্ঠানটি উপভোগ করেছেন। শেয়ার করবেন, লাইক করবেন এবং আবারও আপনাদের সঙ্গে দেখা হবে। আমরা ফিরে আসবো অন্য একটি অনুষ্ঠান নিয়ে। ততদিন পর্যন্ত আপনারা সকলে ভালো থাকুন, সুস্থ থাকুন, সেফ থাকুন। অনেক ধন্যবাদ। শুভরাত্রি।